A patient that I had the pleasure to meet today is 48 years old male established patient to our clinic presenting with a complaint of barking non-productive cough for 10 days. He also had a runny nose and sore throat 3 days before the cough, and cough was constantly stable mostly during the day. His wife also has a sore throat and a runny nose at home, plus he had some sick co-workers exposure. He denies any allergies, food, or environmental or medical, no animals at home. He doesn't take any medicine or herbals. His immunization for COVID and flu are up to date. He denies pneumonia vaccine. He has a non-significant family history for bronchitis or asthma. He has never been smoking and denies passive smoke exposure. He had mild alcohol intake and no illicit drug use. He is a lawyer with 20 years of experience, moderate high amount of stress. He denies any significant changes in his life or hazardous habits. He denies fever, shortness of breath, unintentional weight loss or gain. He has a poor sleep at night due to sore throat and cough and mild weakness. On exam, vitals are normal, blood pressure elevated, which is concerning. He was positive for respiratory wheezes all over lung fields and red inflamed throat, no tonsillar exudate and no swelling. Eyes, ears, and nose are intact inside and out, no lymphadenopathy or neck lumps, no cardiovascular involvement. Based on the picture, he most likely has acute bronchitis. Arguments for it: barking non-productive cough for 10 days, mostly during the day, contact with sick wife and co-workers, no fever, no allergies, no medicines such as lisinopril, no significant family history like asthma, no smoking ever. Arguments against that: respiratory wheezing, but no crackles all over lung fields. Secondary diagnosis: influenza. Arguments for it: flu season, mild weakness, presence of runny nose at the beginning, sick contacts exposure, sore throat, red oral mucosa, no eyes or ears involvement. Arguments against that: patient is up to date on the flu and COVID vaccine and had no fever. I had difficulty differentiating between URI and influenza for diagnosis. The symptom and presentation for both are very similar. How can I better differentiate between those two? Are there any differences in the treatment in his situation? His blood pressure was a concern as well. That's why I recommended maintain a blood pressure log twice daily and bring it to the next visit. Plan was chest x-ray to rule out pneumonia, CBC with differential, throat swab to rule out flu A or B. Treatment: prescribed thessalonprospirine for cough, decongestant if stopped runny nose, promote warm hydration, promote rest, saline goggles twice daily, warm compresses to relieve sore throat. Learning issues or needs: focus on symptomatic care, stress, and passive smoke reduction. And seek contacts avoidance, consider getting the pneumonia vaccine later, and hand hygiene. Other than what I have already mentioned about learning needs and blood pressure monitoring, the patient didn't have any barriers to healthcare or such.